pregnancy. So if we have to have ART without OHSS, we have to first understand the disease, the prediction, prevention, implementation, and what are the treatments, how do we further treat it. And we all hope that we will never have to treat severe ovarian hyperstimulation syndrome. So the main culprit is VEGF, that is the vascular endothelial growth factor, which regulates the follicular growth, the corpus luteal function, ovarian angiogenesis, neovascularization, and acceleration of vasopermeability. So for understanding the disease, VEGF mRNA is expressed after the LH surge, and this is enhanced further by HCG in a dose and time dependent fashion. So kinetics and levels of VEGF correlates with the severity of ovarian hyperstimulation syndrome. The clinical course, capillary leakage, leukocytosis, and increased hematocrit. So this is a chart which shows how ovarian hyperstimulation occurs, the main culprit being vascular endothelial growth factor. So in this pathogenesis, the first thing is there are many follicles, the sustained levels, high levels of estradiol, and LH sustained surge, which triggers the whole scenario. So in prediction, which patients are likely to suffer? The PCOS group, the younger age group patients, low body weight, previous history of ovarian hyperstimulation syndrome, and high E2 levels and large number of follicles. When we use HCG to trigger ovulation and use of HCG for luteal support. So how do we reduce the chances? We have to avoid the flare-up. The many follicles and high E2 levels have to be avoided, and the sustained and long LH surge has to be avoided. So to reduce the chances of severe ovarian hyperstimulation, once we have lot number of follicles, we can do coasting, where we stop the gonadotrophin stimulation and we continue the agonist suppression until the E2 levels decline before proceeding to egg collection, that is before we give the trigger. Then we lower the dose of HCG to trigger ovulation. We can even freeze all the embryos, cryofreeze them and transfer them in the next cycle. Dopamine agonist, cabergoline, has been used to treat ovarian hyperstimulation. And then we have IV calcium. So in coasting, there are various studies and most of them suggest that there is no evidence to suggest the benefit compared to coasting and other methods. Where we lower the HCG dose, the rationale is HCG induces vascular